Last week I talked about caregivers and how they fit in with the Alzheimer's. This week I want to dig a little deeper into that, and I am going to give you some perspective from the patient's view, or at least my view. I think some of this is going to be enlightening. There are millions of people who are listed as caregivers for people with dementia in one form or another in the United States. So it's a big deal. Early on in Alzheimer's and other dementia illnesses, people experience changes in the way we think, the way we reason things, and it will affect our daily life. Eventually, it's going to get to the point where we will need help with everyday tasks. These may include bathing, grooming, getting dressed, helping eat. It is upsetting from our perspective that we can't do that anymore. I was told that, as best I remember, I have an IQ somewhere in the 125 range. I got a bachelor's in science and nursing, which is supposed to be one of the hardest programs there is. And I don't remember, 3.6 or 3.7 GPA, somewhere in that neighborhood. But all that intelligence that I used to have is going away. For a lot of my career, I had jobs that I had to make split-second decisions on things that could mean life and death for someone. You don't want to count on me for that anymore. So on to the tips. Try to keep a routine, such as bathing, dressing, and eating at the same time each day. Help the person write to-do list, their appointments, and events on a notebook or calendar. I would show you my phone at this point, but my phone's being used to record. But the phones are a great asset for keeping reminders, as is the Alexa that we talked about in another video. Today's technology makes that a lot easier. Consider a system or reminders for helping those who must take medications regularly. Again, this is something we talked about. I get reminders on both my phone and the Alexa system when it's time to take my medications. Buy loose-fitting, comfortable, easy-to-use clothing such as elastic waistbands, fabric fasteners, zipper pulls instead of shoelaces, you know, the Velcro shoes and things that we all turn up our nose at, but that's going to be my fashion soon. Use a sturdy shower chair if the person is unsteady, prevent falls. They're cheap, they really are. Be gentle and respectful. Tell the person what you're going to do step by step while you help them get bathed, get dressed. Let us do what we can, but there will be a point where we need help. Serve meals in a consistent, familiar place and give the person enough time to eat. So far, I don't have any problems eating. Some tips for changes in communication and behavior for people with dementia. Communication can be hard for people with Alzheimer's because we have trouble remembering things. We can also become agitated and anxious, and sometimes even angry. And we will talk about that a little bit more a little farther in. The language abilities can be affected by people having trouble remembering the right words, may find words that aren't the correct words. So to help make communications easier, I'm going to go over this list of things you can do. Reassure the person. Speak calmly. Listen to his or her concerns and frustrations. Try to show that you understand if the person is angry or fearful. As I said, we've spent our adult life, and a lot of our childhood, talking. And after almost 70 years of talking, and those words are starting to get hard to find, it's very frustrating for those of us who know it's happening. In the later stages of dementia, there's probably not aware of that, and so it's not as bad. But in the early to middle stages, where we know there's a problem, but we can't do anything about it, very, very frustrating. Allow the person to keep as much control in his or her life as possible. Respect the person's personal space. Build quiet times into the day, along with activities. Keep well-loved objects and photographs around the house to help the person feel more secure. Remind the person who you are if he or she doesn't remember, but don't say, well, don't you remember? Don't you know who I am? No, Captain Obvious, if we knew who you were, we wouldn't be confused, okay? So don't do that. That's just mean. Encourage two-way conversation as long as possible. Try distracting the person with an activity such as a familiar book or photo album if you're having trouble with communicating with words. Tips for a healthy and active lifestyle for people with dementia. Eating healthy and staying active is important, especially for people with Alzheimer's. As the disease progresses, finding ways to eat healthy foods and stay active may be increasingly challenging. So here's some tips for that. Consider different activities the person can do to stay active, such as household chores, cooking and baking, exercise, gardening. Match the activity to what they can do. I still cook. In fact, I can throw in a little B-roll of breakfast that I made, but when it gets to the point where playing with fire is dangerous, then it's probably not time to be letting us play with fire. Add music to exercises and activities. Dance to the music. Yeah, I don't dance. Be realistic about how much activity can be done at one time. Short activities may be best. Take a walk together each day. Exercise is good for the caregivers too. And as we've discussed in a couple of videos, even walking is a good exercise for Alzheimer's. Buy a variety of healthy foods, but consider food that is easy to prepare, such as pre-made salads and single portions. Give person choices of what to eat. For example, would you like yogurt or cottage cheese? No, I would like ice cream. While healthy foods are beneficial for the brain, there's also the side of let us enjoy what we can. Next is tips for home safety for people with dementia. And we talked a little bit about playing with fire and dangerous things. But as a caregiver or family member to a person with Alzheimer's, you can make steps to the home safer. You can take steps to make the home a safer place. Remove hazards, adding safety features around the home to try to help us be independent as long as possible. Some of these tips are if you have stairs, make sure there's at least one handrail. Put carpet or safety strips on stairs. Mark the edges of the stairs with brightly colored tape so they're more visible. Insert safety plugs into unused electrical outlets. Consider safety latches on cabinet doors. One of the discouraging things is basically child-proof your home all over again, just like our parents had to do when we were little, because that's where our mind is going. Clear away unused items and remove small rugs, electrical cords, and other items that are trip hazards. Make sure all the rooms and outdoor areas have good lighting. I have put night lights in the bathrooms. We have at least 2 lights in the house that can be controlled with Alexa. Some motion lights will probably be coming down the road.
Sounds like you're planning some exciting upgrades. When you get those motion lights, I'll be ready to help you set them up and control them.
And again, Alexa doesn't eavesdrop or anything. Remove curtains and rugs with busy patterns that may confuse us. Remove or lock up cleaning and household products such as paint thinners and matchers. Again, child-proof your home. And tips for caregivers. We talked last week about taking care of yourself, so that's very, very important. Being a caregiver can be extremely rewarding, but it can also be very overwhelming. Caring for someone with Alzheimer's or related dementia can be a struggle. It may be difficult. It takes time and effort. You might feel angry, which may be a sign that you're doing too much. And some other tips to help you, or ask for help if you need it. This could mean asking family or members or friends to help or reaching out to local services. Eat nutritious foods, which can help you keep healthy and active longer. Join a caregiver support group online or in person. Meeting other caregivers will give you a chance to share stories, compare notes, and get some ideas. With today's technology, you've got all kinds of things like Zoom and Meet that you can even do it from home and talk to others. A lot of therapists will even have online appointments if you need to. Take breaks every day, making a cup of tea or calling a friend. Spend time with friends and keep up with your hobbies. Get exercise. Go for a walk by yourself. Try yoga. Tried it. It's not made for old stiff guys. Try practicing meditation. Research suggests that practicing meditation may reduce blood pressure, anxiety, depression, and insomnia. Consider seeking help from mental health professionals to help you cope with stress and anxiety. So for the next section is planning for the future, tips for caregivers. Making healthcare decisions for someone who's no longer able to do so can be overwhelming. That's why it's important to plan healthcare directives in advance. We did a video about pre-planning, and if I knew how to do it, I would link a video now and say it's up here, but you'll have to find it on my playlist. So start discussions early with your loved ones so they can be involved in the decision-making process. Get permission in advance to talk to the doctor or lawyer or the person you're caring for as needed. Cell phones is one of the things we went through that you may have to take care of. That there's so many things nowadays that they say, well, I need to talk to that person. Well, if we're non-communicative or do make no sense, that's not going to be helpful. So get these written directives ahead of time. Especially things like bills, health care, things like that, because without a consent or a directive, you're going to be spinning your wheels. Consider the legal and financial matters, options for in-home care, long-term care, funeral and burial arrangements. We have already taken care of those. And learning about your loved one's disease will help you know what to expect as it progresses and what you can do. Going on with tips. Again, it says maintain a consistent daily routine, ensuring safety at home, clear, simple communication techniques, try to minimize confusion and frustration, use safety tools, foster independence as much as possible, plan for future care needs, respite services if you can find them, and remember to prioritize your own health, because if you're a caregiver and you go down, you're not helping. So reading some key tips. It says establish routines, structure the day with consistent times, simplify communications, use short sentences, speak slowly, address them by name, use simple yes or no questions to avoid overwhelming us. Again, install handrails, remove trip hazards, locks to secure the home, manage behavioral changes, focus on routines to manage sundowning, which is increased agitation late in the day, limit caffeine, don't touch my coffee, ensure adequate daytime activity to encourage better sleep. And the next one is actually going to talk about the behavior changes. Foster independence as much as possible, dressing, using clothes that are simple to get on, elastic waistbands. As far as caring for yourself, again, seek support groups or someone you can talk to. Take breaks. Be patient with yourself. Accept that you cannot do everything perfectly, and it is normal to feel overwhelmed. Some daily management tips or label items. Put notes or pictures on doors and cabinets to help with memory. Use visual aids. Instead of just asking what shirt do you want to wear, pick up 2 shirts and ask them to pick one. And again, maintain their nutrition levels. So I mentioned a little bit ago about behavior changes. I thought I was turning into a grumpy old man. I did not know if it was Alzheimer's, depression, combination. It turns out there's actually a name for it, and it's called Alzheimer's disease agitation. And it is defined as a group of behavioral symptoms that commonly occur in people with Alzheimer's disease. Agitation symptoms can include emotional distress, verbal or physical aggression, and resistance to care. In one study, 76% of patients with Alzheimer's disease experienced agitation. Agitation symptoms can affect relationships, keeping your loved one from participating in moments that matter. Some of the common features include restlessness or pacing, irritability and mood swings. Irritability, oh boy. Yelling, shouting, and cursing, even physical aggression, wandering or repetitive behaviors, and we will get into a little more of that irritability shortly. Remember to try to set achievable goals. The goal setting will be a team effort between you and the dementia patient. So work together to set goals, which may include visiting friends or family. They talk about bird watching. Nowadays, they've got a lot of bird feeders that have cameras on them. So that's something that I would assume, I don't have one. You could even project on the TV so it'd make it easier to watch. In walking together, you know how many times taking walks has come up over the last few months that we've been doing these? Watching favorite movies. Regularly share a record of goals with your loved one's healthcare team and revisit these goals time to time to see what's working and what needs to be adjusted. And remember to try to set goals to help your loved ones, us, aspirations, keep them within reach. Managing Alzheimer's disease agitation episodes. When possible, consider these ideas that may help to reduce the frequency of agitation episodes. Make sure we're comfortable. Check for hunger, thirst, constipation. Again, like a baby. Make sure we get enough rest. Identify situations that may trigger increased agitation. I know for myself, having been in law enforcement for a time, people who don't drive well annoy me very, very much. I can get pissed off just because somebody did not use their turn signal. Not a big deal, but it just hits me some days. Not all the time, but some days. And the bad thing is that when we hit those episodes and start getting angry, everything seems to just build on top of that. The more you think, the more I think about it, the angrier I get and the more things I get angry about. So it's a slippery slope. Explore soothing therapies. Music tames the savage beast. I don't think that's quite right, but there's something to that effect. There's actually music, art, and pet therapies that we'll go into again here in just a minute. Probably the most important thing you can do is try to stay calm during an agitation episodes. Look for the reasons behind our behavior. Try to understand what's causing this agitation. Redirect their attention. Hey, look, a squirrel. Probably won't cut it, but doing some activity, maybe. Provide a security object. Make sure they can see and access something familiar, like a favorite quilt, pillow, or mug. Your toddler's favorite blanket. Just does not help the agitation and depression to think how much we're reverting back to being a child at this stage. But most important is don't be confrontational. We're not trying to be assholes on purpose. We can't help it. And a little more on the music, art, and pet therapies. Music is a powerful tool. It can actually help reduce agitation, but know what kind of music your loved one likes. Or you may have to experiment a little bit to find which one will calm them. Playing something they hate is probably not going to work. Art therapy, for those who are so inclined, drawing, painting, doing that kind of thing can be very calming. Pet therapy. Pets are marvelous. My sister had a therapy dog at one time. They're a very, very good resource. It requires, for the most part, specially trained animals, but even our dog is calming most of the time. So we're going to switch gears now and talk a little bit about depression that comes along with Alzheimer's. The statistics are going to say up to 40 or to 45% of Alzheimer's patients have depression. I wonder how they come up with that figure. Is it a chart review of how many people diagnosed with Alzheimer's had a concurrent diagnosis of depression? Because there's probably a lot of them that didn't get depressed, especially if they didn't get diagnosed with Alzheimer's till later. We're not going to know that they're crazy. But in the early stages, when we're still with it enough to realize that we have a cognitive decline, it's very depressing. I said we've done several things already that it's like taking care of a toddler again. Some of the symptoms will include social withdrawal, which is very true. I have that. But in some of the other videos, again, find my playlist. The social interaction is important to help keep the brain working to delay the onset of Alzheimer's. So there's a big conflict going here. Both conditions, Alzheimer's and depression, can cause apathy, confusion, social withdrawal, difficulty concentrating. Apathy is a big one for me. I can look at my yard and say, I need to mow, I need to do this, I need to do that. I don't want to. There's some weeks I don't want to make these videos. I have to force myself to do it. Don't care. Depression typically has a more rapid onset, whereas dementia is more gradual. Those with depression are often distressed by their cognitive issues, while those with dementia may not be aware of them. And again, early stage of dementia, you are aware of these cognitive issues, so that causes depression. Untreated depression in dementia patients can worsen cognitive impairment, increase dependency, and lower the quality of life for both the patient and the caregiver. Some symptoms may differ slightly from standard depression because patients may struggle to express feelings of sadness or guilt. Some of the key indicators are loss of interest in previously enjoyed activities, the apathy, social withdrawal or isolation. Again, we need that connection for our brain. Increased irritability and agitation that we talked about. Reduced energy, fatigue, and slow movement. Yep, those are here. Common risk factors are biological. The dementia-related brain changes can also cause the depression with the chemical imbalances and structural changes. Vascular disease is a strong link to depression, where stroke or blood vessel issues in the brain contribute to both illnesses. Psychological or situational, that's another good one. Dementia diagnosis, loss of independence, social isolation, and stress are major factors. When Dad was getting into the later stages, his comment was, I want to die on this farm. He farmed all his life. We did what we thought was best. At this point, I'm starting to see it more from his side. The physical aspect is chronic pain, poor sleep, other medical conditions. My pain's pretty much managed. Melatonin helps the sleep. We had one of the medications that they started me on at one point that caused insomnia really bad, so I did not take that one very long. Management and treatment for depression and dementia patients is important because it can be managed and may help. I think it's interesting, and I don't remember who this article, where I got this one. The first step is non-pharmacological treatments, engaging in daily activities, social interaction, physical exercise, consistent routines. Sounds good. Psychological therapy, counseling or cognitive therapies tailored to our ability. And last should be pharmacological. The SSRIs, or selective serotonin reuptake inhibitors, and other antidepressants require monitoring. At my age, I'm very limited on what I can take. But you know, that's the first thing I was given. Here, have a pill. Thank you, Big Pharma. And last but not least, of the ones we're going to talk about today anyway, is the 90-second rule. The 90-second rule is a communication strategy where you want to allow 60 to 90 seconds for a person with dementia to process information and respond to requests. Dementia causes slower cognitive processing. So if you ask a question and we don't answer right away and you say, "Have you got your hearing aids in? Did you hear me? Answer me," is not helpful because that puts even more stress on our brain and overloads it. And yes, hearing can be a problem. I get yelled at often for not having my hearing aids in spite of the fact that they cost thousands of dollars. If I wear them for a day, my ears are going to be irritated and itching for several days to follow. Don't know why. I don't know if it's something in the neoprene, rubber, whatever it is, in the earpieces, but it's very, very annoying. When I walk, I wear shocks. If that shows, because they do not go in the ear, so I can hear from them, through them, but they're not in my ear, so they don't irritate me. I wish they had hearing aids more like this. Anyway, back to the 90-second rule. So when you ask a question, give them 60 to 90 seconds to respond because we're processing this. And according to the experts, at 60 to 90 seconds, sometimes it takes me longer than that to think. Part of that is not just wanting to pop off the first thing that pops in my head because I'm still cognizant enough to know that that may not be the right answer. It'll come later. Avoid resetting. Each time you repeat a command within those 90 seconds, you restart the clock for our processing, which makes it more confusing. Give single-step directions. Break tasks into one step at a time, allowing from time in between. And like I said, they keep saying 60 to 90 seconds, but sometimes it may be 2 or 3 minutes. Use visual or tactile cues. If no response occurs after 90 seconds, use verbal cues like pointing, demonstrating the action, or gentle physical guidance, but be careful. If you grab an arm or something, you may get back to that physical aggression thing. Most of all, be patient. We are not refusing, just trying to be obstinate to be a pain in your butt. Our brain's not working correctly. The benefits of using the 90-second rule, it's going to reduce behavioral issues. Giving some time will lower the frustration for us and prevent outbursts. And will also, if you keep that in mind, it will, actually we'll talk about that again. Here, I'll follow that thought up. It improves engagement, gives individuals a chance to answer, promoting independence rather than rushing us. Decreases caregiver burnout. The cycle of repeated questions gets old. I know it does. So just give us a little time. And the note that I was referred to a second ago, a different 90-second rule based on neuroscience suggests that the physical and chemical reaction of an emotion only lasts 90 seconds. So encouraging caregivers to allow themselves 90-second pause to manage their own reactions to challenging behavior may be beneficial. So there we go. There's a lot to process. Some of this we may dig into deeper in future videos. I get a lot of comments from people saying, thank you, this is some helpful information, and that's my goal as long as I can. So please give me ideas, things you want to hear about. I try to keep track of the things that people like and expand on them more. Like and subscribe, and we will see you as the battle continues.